Hi guys, my name is Rola Rabah. I am an oral maxillofacial surgery resident at Boston University. This is a day in the life video. I'm going to take you along to show you what it's like to be a surgical resident at my program. I am part of the combined MD DDS program, and so I've already done my 2 years of medical school, got my MD degree, finished my OMS intern year, and now I am in my general surgery intern year. I'm really happy that I'm applying a lot of things that I've learned in medical school on my general surgery rotation. And without further ado, let me take you on to the ride and show you what it's like to be a surgical resident. Let's go. It's 5 a.m. and this is typically when I head into the hospital. So the sun is not up yet, but we are getting to work. My day on trauma service starts with me getting into the hospital around 5:15 a.m. We have sign out at 5:30 in the morning where we hear from the overnight intern about what happened overnight. And then we round very quickly with our chief residents, and then we report back to our attendings. And so it's very, very quick. By 7:30 in the morning, we've already seen all of our patients and we have a plan for the day. The rest of the day gets broken into just management of floor patients, so writing notes, putting in orders, discharges, and then the other part of the day is dedicated to the ORs. As an intern, I get to jump into certain surgeries and procedures, which is really fun and exciting. So trauma surgery is, of course, really fast-paced. It could be super unpredictable. It's a great service for OMS residents since we do a lot of face trauma, and actually at my hospital where Q2 we alternate with ENT, so there's a lot to learn for me on the general trauma service at my hospital. Sometimes during the day though there is a little bit of downtime once we round on all of our patients, and if people are stable, that's the time that I actually use to head down to the OR, see what's going on. If there's no trauma surgery, sometimes I'll pop in and try to find some OMS surgeries, and that way I'll just kind of like keep up with the service and see what's going on. So let's go see what they're doing. So we had one OR running with Dr. Salama for head and neck cancer, and I just realized that Dr. Mera is running another OR doing orthognathic surgery. So that's 2 ORs running, and a lot of our other attendings will operate on different days in the week. All right, so just headed to the OR, and look who I ran into, one of my co-residents.
Hello.
Hey, Mike.
I'm Michael. I'm a second year. I'm on my anesthesia rotation. It's great. You get to learn all about your airway management and taking care of patients under anesthesia.
How many more months do you have?
I have 2 more months.
2 more months.
We do 3 months at Boston Medical Center and 2 months at Franciscan Children's Hospital.
So we get to learn pediatric anesthesia, and then we get to learn adult anesthesia, so it's pretty fun.
From general anesthesia to sedation. It's awesome.
I go to anesthesia in a couple of months, but Mike did anesthesia first. So we all have different rotations, but we're going to be in the same class together, so we'll be seniors next year.
Yep.
All right.
Absolutely.
So that was fun and exciting. 2 hours running, and a lot of our other attendings will operate on different days. So it's a pretty busy program. Great for resident learning. Now I have to get back to my responsibilities on general surgery. So I'm gonna go see some of my patients and get ready for sign out. So things are a little bit complicated in the COVID area. We have to get all gowned up in order to go see some of our patients, but our hospital has been doing a really great job keeping up with COVID PPE recommendations, and so during the whole pandemic, luckily we've been pretty safe. Hi guys, so I am at BU School of Dentistry. This is more of a private practice setup. It's on the same medical campus as our main hospital, so it's really easy to get to. We do a ton of cases here under IV sedation, like impacted wisdom teeth. We'll work with the pediatric department, the ortho department, the perio department, the pros department. It's a really great multidisciplinary center where we do a ton of surgery planning, lots of consultations, and it's a great private practice type setup. You can see here it's a well-equipped dental clinic. So a really exciting part of our clinic at BU is all of the new technology that we get to play with as residents. We get to train here. Lots of really exciting things. This is our minor procedure room, so where we do IV sedation, we do robotic guided implant surgery, which is the way of the future, and we're all very excited about training here. And you can see there is a full spectrum of different robots, different navigation, different systems that we all get to learn as residents, and we get to practice as well, which really just sets up for a successful private practice. And so I love that we get to experience implant dentistry the conventional way, but also get to learn about all of the new advances at BU. Okay, so it's about 1 p.m. and I'm going to go get some lunch. I don't always get to eat lunch because a lot of times my schedule can be unpredictable and I'm running around from one place to another, especially on trauma surgery, but it's no different on OMFS service. But today things are calm, so I'm going to take advantage because one of the rules of being a surgical resident is to eat whenever you can and sleep whenever you can, so I definitely do both. Time for some lunch. Okay, so I am going to go see my patients in the afternoon because I like to round on them in the morning and then see them again in the afternoon to see what things have changed, what's going on with everyone, see if anything has come up during the day. And at that time, a lot of the consulting services like PTOT and other services have already seen my patient, so I can kind of get updates from the different teams, and that's usually what takes up most of my afternoon on trauma surgery. And of course, you never can predict trauma, so sometimes traumas come in and interrupt my afternoon rounds. All right, you guys, so it's about 6:30 p.m. and I am all done. I get to head home now. The general surgery engineer is definitely tough because you are working a lot of hours. So I basically just finished a 12-hour shift, but I get to now go home and have some dinner and maybe watch some brainless TV and shut my brain off and then go to sleep, wake up the next day and do it all over again. So it's definitely a very long year that's overwhelming, but it is a huge learning opportunity. It's a lot of fun, and I get to apply a lot of things that I've learned in the last few years. It's a challenging experience. You learn so many new things, and every surgery is a learning opportunity. Every service is a learning opportunity. It just makes you a better surgeon in the long term to really understand how to manage patients, and every surgery you can learn things even if it's not related to what you're going to do in the future. So I take every learning opportunity as a time for me to just get better so that when I'm back on OMFS service I could really just indulge in the scope of OMFS and become the best surgeon I could be. I hope you guys enjoyed this day in the life video. I know that this year with COVID things are a little bit different, but I tried to show you as much of my day as possible. Hope you have a wonderful rest of your day and stay safe.